Good afternoon, everyone, and welcome to this panel, Innovation for Care Technology panel. We in the panel have been looking forward to be seeing you this late afternoon, but we are ready. And we have a very interesting panel, and I'll start by introducing shortly myself and the panel, and then we'll do a short tour around the panel. My name is Peter Julius. I'm the CEO and founder of Public Intelligence from Denmark. We work with health and care innovation. So we actually do innovation together with municipalities, care homes, and home care units in Denmark and across also Europe and Japan, actually. I've been working within this field for more than 20 years. It is the most interesting field within health and care in the world. And I'm sure that we can elaborate on that in a short while. But let me introduce this very, very strong panel. And let me start by Susanne. And when I introduce you, Susanne Dröscher, you are the co-CEO and co-founder of CARU. And I will let you do your remarks, but have two questions for you at the same time. So one question is, what are the story behind CARU and what are your ambitions really?
Right. Thanks a lot, Peter. I'm very, very glad to join this panel, and I'm looking forward to our discussion. So I want to start really with the first question. What are our ambitions? So our ambitions are really that we want to shape and bring to the market the most simple and intuitive tech companion that allows for healthy living and safe aging. And why do we believe that this is important, and why did we at all go into this market? Well, I think you're all aware of the demographic change and all the challenges that go in line with that. So I just heard in another discussion that we will have 500,000 care staff missing in Germany in a couple of years, and that's 500,000. That's a crazy huge number. And every seventh person in the country will actually be in need of care services in some form. And so there is clearly a mismatch. And on the other hand, we believe that people should be enabled to live independently, even at high age. And that's why we have been looking into what can be done in terms of technology to actually support this desire that people have, and also this challenge that we have as a society. We are two founders of CARU, both with technical backgrounds. So in order to figure out better what is actually the need in these markets, we have been talking to more than 200 people that work in this space in order to figure out what is the daily worries that they have and the issues. And based on what we found there, we have then created our tech companion. And I just want to quickly show it. At the heart of it, there's this little device that is being placed in all the people's homes that helps them to communicate. Actually, you can interact through voice with it. And it at the same time also monitors the room and can detect normal activity patterns or also anomalies here. So we really see ourselves as a companion, both for the older person, for the relatives, and also for the care staff, to really make everyday life easier for all of them.
Thank you very much, Susanne. And now, Judith, going over to you. You are the CEO for Care for Innovation. And I have two questions also opening your remarks. Why Care for Innovation? And what are the ambitions behind Care for Innovation as well?
Okay, thanks a lot. I'm glad to be here, and thanks for inviting me. Why Care for Innovation? So the idea first came up at the Altenpflege Trade Fair in 2018, which is, by the way, the biggest trade fair for elderly care in Germany. So, and with Supernurse, with my scale-up, we joined the Aveneo startup area and met several other young healthcare startups there. And it became quickly very clear to us that a lot of us were facing similar difficulties and challenges in the German health healthcare market, for example, in terms of searching for investors, the lack of digital infrastructure, and many, many more. So, and that is why we decided to found Care for Innovation. So we are an association for young healthcare startups, and we aim to support and connect like-minded innovators in order for digital healthcare transformation to succeed. And I already mentioned Care for Innovation is an association of young innovative startups, and our purpose as digital healthcare experts is to meet the challenges of an aging society through digital and innovative solutions. And in our association, we offer a space for communication and exchanging our experiences and expertise to break common ground in order for digital transformation in the healthcare market to succeed.
So, Judith, it's fair to say that you are a cluster on a network ecosystem that actually binds both the tech side together with the need side, or is that a fair translation?
Yes. Yes, we found at Altenpflege, I told you, and we want to go together, and I'm CEO and founding member, and we found we have to give nurses more self or confidence in themselves by increasing their expertise, and they have the chance to use their time with the patients and try to save more time for the really things in care.
Thank you very much. Arild, you're from Norway. Could you tell us a little bit? You are the CEO of Norwegian Smart Care Cluster. Could you tell us a little bit about Norwegian Smart Care Cluster, and could you tell us about the ambitions behind it?
Yes, thank you, Peter, and thank you for inviting us to this panel. In Norway, clusters are seen as a tool from the government to either build industries or build regions. So for us, we are working to build the care side of the health industry as a new industry in Norway. So in our cluster, we have 230 members, of which 170 are companies in various ranges, a lot small startups, and we work in the space of solutions that follows me from in my home into the municipality or into the hospital or nursing home as see fit. So the thing about the cluster is to help scale companies. But in order to do that, since health is public in Norway, we also need the support and from the municipalities, hospitals, university sides, investors, which are all part of the cluster. So our goal is, of course, for our member companies to create impact, to make a difference in people's lives, helping them to live a better life at home, and at the same time build a prosperous business doing that and exporting and sell it to the rest of the world.
That's quite ambitious. Thank you, Arild. Thank you. Julian, you are the co-founder of managing partner of GründerAtelier. Could you tell us a little bit about the background of GründerAtelier, and also a little twist in the question for you is, how does future look like for early startups? I think that will make sense when you have explained what you actually are doing.
Perfect. Thanks a lot, and thanks a lot for having me here. Yes, definitely. So GründerAtelier, we see ourselves as, on the one side, as a company builder, a classic venture builder, and on the other side as accelerator for early stage companies in the healthcare sector mainly. So what we're doing is really focusing on the investment readiness processes of startups and enabling the founders basically combining our efforts with the efforts of the founder team in order to really efficientize the whole process of stepping into the market, and especially stepping into the game of fundraising in an early stage when usually they never did this before. So I guess that's very important. As I'm representing here the investor side, we are not investing our own funds, but we are more let's say sweat equity what we are doing. Regarding your question of the future future of care technology or early stage startups in the market of care technology. I think what is very important in this market, as in healthcare in general, is that there is a high national efforts, and the internationality, especially with digital solutions, it's always quite tough. It's not as easy. On the other side, we see, and we also covered this in one of our recent reports about remote patient monitoring, we see a really high value added in solutions that are basically enabling a better patient monitoring, a better caretaking of the patient. So really patient, let's say human focused. That's very important. Another thing that we see as very thriving in the future is individual solutions for patients that can really be majorly impacted by the technology in care. So I'm really looking forward to the panel today and to discussing especially this topic. And that would be my opening statement.
Thank you very much. I would like to ask the audience to please type in questions if you have any, and I promise you we'll try to answer them as fast as we can. We really love if you have any very tough questions for us, so we can use that in our discussions today. I would like to start the discussion with a very broad, maybe easy to answer, but maybe also difficult to answer shortly question. Why is the health and care market so attractive? Anyone?
I can.
Arild, sorry.
I can chip in and say, I mean, it's in a lot of other industries, they are cyclical. I'm from Norway, so we follow the oil price, and if it goes down, it's bad for all of us. But health is, we are living longer all over the world. We're living longer with more diseases hitting us. So it's it's a counter-cyclist thing. It's growing all the time, and I don't think there's ever a stop for it. So which other market can you show that always grows? So I think that's, and I think also it's good that it affects all of us. Everyone has a health in some stage. And,
So it's a growing market where everyone can chip in on the need side. We all need good health and care in the future. And with my age, we need to hurry up because I'm 52, so you need to be a bit fast. Susanne, you are actually doing technology or working with technology in people's own home. Do you see the home as a future like entity of care?
Right. So this is actually also a follow-up basically to your previous question. I think, there will be more and more people growing older and older. And we have not yet really deployed technology in this field very effectively. There's only very, very few examples where technology is actually being used to support care workers and this desire of staying at home. And this is actually a factor that goes into the whole thing. Less and less people are actually looking forward and looking for a place in a nursing home. This is a huge trend. So people prefer to stay at home, and this whole topic of decentralized care will keep us busy for sure. And it is a positive thing because in the end, this also allows for intergenerational living, which in the end keeps mental health stronger and is really a positive factor in the older adult's life, for sure. But it also poses challenges that are how to distribute the care workers, how to get them from one spot to the next one efficiently, because there are so few of them. So I really think that, staying at home or staying in, maybe not in the single family house until the end of life, but in moving into some intergenerational living, these are concepts of the future, in contrast to very centralized care as it has been in place, more in the last century, and it's slowly going a little bit away from that. This staying at home is definitely a trend that I think it's present in almost all, at least in the industrialized countries.
And talking about the lack of technology deployment within this sector, maybe giving the microphone to you, Judith. Do you see that small tech companies can... Do you have a problem hearing me? I'll switch.
Sorry, I can't. Sorry?
It's okay, Judith. I'm just talking about, the tech companies that are in need of developing technology within this field. Typically, they're very small, and this health and care market seems so big. Do you see
Sorry, Peter, I don't know if the other one also don't hear you.
Okay, Julian, do you hear me?
I hear you.
Okay.
Perfectly.
Sorry,
Okay, Julian, I'll try to give you the answer, then we'll look into Judith to see if she connects back. Julian, the small startups are very, very small companies, and the health and care sector, hospitals, care home, municipalities, regions, they are so big players. What are the difficulties by being a small startup trying to develop technology and embed it into the care system? Do you have any experience with that field?
There is, I would say, a very high difficulty compared to other sectors that we could look at. And the thing is that a lot of the startups maybe focus on digitalizing solutions for these hospitals, for the care centers, and there's already a technological problem that basically the infrastructure needs to fit together. So that's maybe one approach that we would favor, or we do favor, and I guess Arild can probably also copy that. That clusters are really advantageous for this, in order to bring together the startups in a really early stage with the actual care providers. Otherwise, you're deploying in a direction, and in the end, nobody can even use it or wants to use it. So I guess that's really a tough one in the care sector in general. And on the other hand, I can definitely cover what Susanne said, that there's a trend going towards you want to stay at home, you don't really want to go into the nursing home. And I guess there's really a high chance for startups that are tapping into this market of providing a better mental and physical well-being, not only physical, but really also mental well-being for the older people that are at home, because we are not in the time anymore where the family is around you, but usually the family is somewhere else in another country or wherever. And there's really a high potential for these solutions.
Maybe I can. Sorry.
Yeah. Was it me, Peter?
Yes.
Yeah. So coming back to I've been running the cluster for 7 years, and I've seen the maturity growing in this space where a lot of companies develop products and technology while the caregivers are delivering a service. And that service usually consists of more than the one product from the one vendor. So what we have been seeing and saying is that you need to find a place in the caregiving chain, and networks are really important to do the value chain. So you need to understand what are the value chain, what are the technology components into that, and find your place into it. I think that is something that a lot of startups are struggling with.
Thank you. Susanne, I saw you had you raised your hand before, and then Judith afterwards. Susanne?
I just wanted to add on what Julian said just before, this topic of isolation or social well-being. So I think it all helped us in a way, what we experienced in the last year or so, where all of us, we suddenly got very isolated. We suddenly got immobile because we were locked up at home. And in a way, it showed us how all the adults that cannot leave their house easily, how it is for them, with the difference that we were still able to connect to the outside world through a lot of different digital channels. And I totally support what Julian says. It's not only about the physical well-being, it's a lot also about the mental well-being and really taking care of the social inclusion of people and really making sure that they stay connected with society, with their families as the most important and caretakers and so on if necessary.
Thank you. They say loneliness is what making every disease even worse. So I think that's a good point. Judith, I saw you've been raising your hand. Should we try to see if we got sound through?
Yes, my internet is okay again. So I want to support what Arild said. I think we have to meet the challenges of the aging society, and Care for Innovation is a very young cluster. So we founded in 2019 November. So and we got 50 members the last year. And Corona, I don't know, it helped a little bit, I think. And I see what we want is to provide a neutral platform for anyone in the healthcare system who is interested in informing themselves about new digital solutions. And on the one hand, it's the relatives also, and the people they need care. So to try and to find assistive technologies, for example, which make living at home for as long as possible easier. That's the one thing, and the other is to give our members or also new startups, the possibility to join our network and to look for possible corporations and so on. So I think that's the right time to place this kind of clusters.
Very good. We have a question from the audience. I think it's actually quite a brilliant question from Jakob Fortujansky. He asks about the business models. So we have had this tech discussion, and we have been talking about the caregiver side. But now there is a question: what business model will we see attractive within care? Selective contracts with insurance, Krankenversicherung, Rentenversicherung, oder reimbursement? Or do you have anyone? Can you give us some feedback on that? Quite difficult question, I think. Any experience, Susanne?
It is a very, very good question. And I think we as a society are still kind of trying to find the ideal setting of this. What we see here in Switzerland is actually that the carriers of healthcare costs and care costs mainly are the health insurances, and on the other hand, the municipalities. So those are the two institutions that they carry the most. And what we do not see so much currently is that the municipalities do something in order to lower their stakes in there. So here we are actually lobbying for making them more aware of what could be done when applying technology and deploying technology in this field. And we would really love to see business models that are also supported by municipalities, because they are really having the chance of saving a lot of costs here. I think in Norway, Arild, you said that there is already like a different movement, if I understood correctly in a previous discussion.
I think in Norway we have a public health system that I think covers 95%, meaning that I, as a taxpayer, pay my tax, and the money are then distributed throughout the hospital and the municipalities. The challenge with such a system is also that I, as a user, may get the benefit, but it's the municipality or the hospital who needs to pay, and they may not always see the benefit. So I think new models will come up, at least on reimbursement side. How do you get reimbursed? Because that is counterproductive to new technologies, new products into the market. That is really difficult to find the reimbursement route for this. Also in a public health system, it's really difficult. So that's something a lot of our members and companies are struggling with, and we are working as a cluster with the other clusters to see how we can make roads into the system so that we can have a predictable route and path to reimbursement for a treatment or product.
Julian, do you see this issue with your companies as well?
For sure, in general, I see it with a lot of companies that we are evaluating. I mean, obviously, we are looking at really a high number of companies, and in the end, you decide to work with a tiny number of these. But what we often see is that there's unfortunately a lack of innovation. And I think if you have a really innovative product that majorly improves the life of the patient and the caretaking, and therefore most likely also efficientizes the process for the care center, you don't really have a problem with monetizing. But you have a problem with monetizing, especially here, if it's just something that's nice to have. And this is what we see. And therefore, we also say we are really focusing on approaches that bring an innovation and that really have the person in the focus and improving the caretaking for the person.
A small comment from me is that it seems that we have, on one side, we have a lot of technology and a lot of tech startups, but also mature technology ready to put into use within the care sector. We have a care sector crying for solutions and very strong as a demand for solutions. But some of the issues are, how do we actually pay for each other? And how do we pay for the services? And also, how can we avoid going from pilot to pilot to pilot to pilot within the health and care sector? So how can we spread technology so it actually gets into an attractive business, looking from a business company perspective? In Denmark, we see that we also test the business models as well. Have you seen that in Germany? Do you test business models and try to elaborate on the best ones? Judith, maybe?
Yeah, I think we are in the beginning. So we have healthcare institutions that are interested in focusing on digitalization, and but they're in the beginning. You know, they need maybe to get a general overview of the existing solutions, and that's a problem, I think. Where we are really in the beginning, but the healthcare startups are, I think, safe to invest in because it's at the beginning. Yeah, and what I really want to emphasize is also in terms of digital transformation, we are not talking about processing more people in need of care faster. So it is much more about giving the nurses and the caregivers, professional nurses, more time to build relationship, or to time to identify patients' healthcare issues based on their professional expertise, and not to save time and to process faster. Yeah,
I think, Judith, that's a very strong point. So you're saying this is not about cutting costs. This is not about doing more for less. This is not about cheaper healthcare. This is actually about better healthcare, and maybe also sustainable healthcare, because the healthcare model we know within care today will not succeed. As Susanne, you said it in the beginning, we're out of hands, and I can promise you in Denmark, we're also out of money. There simply isn't enough tax in the world to pay for an even more increasing health and care system. So Susanne, is that also one of your points moving into this topic?
Well, definitely, and also I want to stress again what Judith says, that people require high quality care, and now that the baby boomers are gonna get into the age where they require nursing care, they will have even like higher desires and demands of what care means to them. So this is also something to consider. Who is it actually that is being old and in need for care? So I think we are really not ready as a society to be able to treat everyone, but we have so many great solutions really at the starting line going into the race. And I really liked what you said about testing business models. That is definitely something that it needs to be done, because I think both sides are really not are not experienced yet. It's a new field for everyone, one can say. So also the care side, the care sector doesn't really know which are the solutions that are most effective. And it is very hard to say sometimes beforehand which is the solution that actually really saves me time. And where does it even help if I save time? Can I then have less employees doing more? What is it that it means that what do I gain if I save time? So this is actually something that is not even yet clear, at least in discussion with a lot of our partners, because a lot of them are obviously also like looking on their profit loss statement at the end of the year, and it needs to make sense. So I think we're all in a learning process. And this testing and the openness to test is something that, there are a couple of institutions that do a great job, and we are super happily working with them and learning a lot on the way, all of us. And I think this is why clusters are also so important, that we can actually exchange among members in the clusters what has worked, what is maybe not the smartest way to go along. And that's why we are very happy as a member also of the Care for Innovation, because there is this exchange happening.
So do you see clusters, do you see clusters as a shortcut for commercialization of this kind of tech embedded health and care? Judith? Can you hear me, Judith?
Yes, sorry, I can't.
Do you see clusters as accelerating the growth and the deployment of technology? Can clusters make a shortcut for companies moving even faster forward?
Yes, I think so, because we have corporations. We like Susanne said, we are joining the network together, looking for corporations, for exchange, for knowledge transfer, and that's really very important, so that any one of us is standing in a point, and everyone is doing the same process, and we can learn. So I have a passion for lifelong learning, so it's I think we could really join each other and say, okay, we go together to the German healthcare market. It's much stronger. Yeah.
Thank you. And Arild, is it the same in Norway? Definitely.
The sum of being in a cluster is network, cooperation, and knowledge. And if you put that into a structure, then we work to accelerate both the adoption of new technology, but also the companies delivering it, because they need to go hand in hand. And I think Norway and Nordics actually has come quite a fair bit on this compared to maybe even Germany and others in that they have been early adopters of new technology, of new services. So we now have several years of experience of what works in a nursing home, what works at home, and they even there are published reports on the health economy of implementing a lot of these solutions based on experience. So there are definitely something to be learned within the cluster, but also between countries, I think, and to accelerate. And that's why we think conferences like this are very exciting for, and now I speak for Norwegian companies, but also for Nordic companies, that we have a good standing to scale out in the world, and with good solutions, proven.
Thank you, Arild. Julian, I know that you work across Europe. Can you see a service in assisting companies going abroad across Europe, or?
A service, okay. Okay, that's, again, here I would really focus on, but that's maybe also a little bit of personal style. I would really focus on technology again, and not only digitalizing the services that are provided right now. I think there's a lot of startups going into this market. That's interesting, fair enough. I see it way easier to assisting startups in going abroad that really have a product that they can sell. But again, here to go on the topic of the cluster, what I guess is very, very important to say in healthcare in general is that you can't just build a prototype in your on your computer super quick as you can do it with other companies. You have you have the certification problem, you have regulations that you need to cover in order to test your business model. What we were saying earlier, it's not like you just say, okay, I'm building up product easily and then I'm going out and testing it. And it's very important also, if you want to go international, to work together with the relevant players in each country in a very early stage and really develop in the direction where it can actually be implemented and be used. Arild said it earlier that you are just one part usually in the whole value chain of the different stakeholders, and therefore that's really important to work together with the stakeholders in an early stage and also with the investor side, because in the end it also doesn't bring you really forward if you only work together with your target customer, but you need to see how can I actually bring value also to the investor, because in the end it's about making money also there.
Yeah, we need to address the money very early. We have 3 minutes and 30 seconds left. I would like to give the word to all of you. So very fast, do you have an advice on growing a company within the health and care market? Do you have any good advice for a new company, Susanne?
Well, definitely look into the market very, very carefully. Talk to people that are in the market already for a long time. Talk to investors, as Julian said, that have been investing in this market, that have made their experience, and then test your product in the market as soon as possible. Build a prototype and go out there and validate that this is really worth some money, and then test and make sure that people are willing to pay. Because people are saying easily that they love the solution, but they're not opening their purse.
We need to get the purses open. Thank you, Susanne. And Judith?
Yes, I think additionally, the same Susanne said, so also share experience in clusters and get in touch with the audience. I think that's the big point. You could, get in touch with them who use the solution. And even though the German healthcare system is extremely complex, I think, but there are a lot of courageous innovators who together are willing to push the digitalization forward. I think that's maybe positive.
Thank you very much, Judith. And Arild?
Yeah, I think in this space, there is coming along a lot of exciting new technologies and so on. So I think the key for all those inventors and companies coming in is the question, is it a need to have or is it a nice to have, as was mentioned earlier by Julian, I think. Because there are a lot of things that are really nice to have, but in the end, who will pay? And that must be a need. So be careful on your need side of your solution. And join and seek collaboration with other companies, so you get into a bigger value chain. That may ease your entrance into a market first.
Thank you, Arild. 30 seconds, Julian.
Yes, I guess the most points were just said already, and I think you really need to early already focus on the fact who pays in the end for your service. We were elaborating on this question earlier. Your target customer in the end, it's not the person that's using your product, but it's someone different, and you need to add value for this person. And I guess that's often something that gets forgotten by the founders. So really do your homework. Who is your target customer? What is your market, and which competitors are there? And I guess then you're set for success.
Thank you. That's a perfect final statement on this panel. Thank you for Sach for bringing this opportunity to us. Thank you to the best panelists today. I think we had a very good, way too fast discussion. We needed definitely more time, but we can continue on that later. Thank you very much and enjoy the rest of the seminar. And thank you to you all. Cheers and bye.
Thank you. Bye.
Thank you.
Bye.
Thanks.